Kevin Rolls already said he could.
You want to Tom, who was previous, colleague.
Yeah, he said, I'm gonna call Dr. Ann, it was something like A and D something. He said, I think he'd be better suited than Dr. Rolls.
Yeah, I mean, Rolf is.
I think so.
You know, at the end of the day, they all got the general training, so.
Like I said, they're going to subsequent thing, but I'm sure they have their niches. That's okay.
Yeah, no, he's appeared at a couple, at least a couple times before. He also does like, he'll say, first lecture on stuff. He like,
And never saw one. Wow, because I never specialized in pediatrics or anything like that. I was telling her we used to hold the little babies, go taste their forehead if it was salty. Remember that? If you were salty, you maybe had cystic fibrosis. I mean, that was an early test strips, I guess, back then. But when I met her, I'm a teacher. I'm a teacher. I became the pupil, and I had to go and read up on cystic fibrosis. I knew all about lung disease and how to take care of people with lung disease and transplants, but I didn't know anything about cystic fibrosis. And she taught me a world about cystic fibrosis, and she's beautiful. She's amazing. She's not just a patient, she is an advocate, of course, for cystic fibrosis. We've done walks, we've done stair climbing at the Rose Bowl, and yeah, I've never been the same after that one. But she's just an incredible young lady who is working on her PhD, but she will have very, very shortly. And she's leaving California also for her clinical, but she's coming back.
oh yeah,
I know she's coming back.
I don't belong anywhere else.
Yeah. I'll sublease your apartment for me as my getaway, for Betsy and I can have a getaway. But it's my honor to introduce Sarah, who's going to speak to you today on live transplant. And October 15th, I think it is, it will be 5 years.
April 15th.
Oh, April 15th,
Good luck for
5
now.
years.
Yeah.
A month from today, that she's been. And she is my inspiration, so please give it up for Sarah Albright.
So sweet, Jackie. Can everyone hear me okay? Okay, great. I mumble, so just let me know if you can't hear me. So thank you guys for having me. I am so excited. I see a lot of familiar faces, which is very comforting when I was a patient, and then people that are new. So I'm so excited to meet you all. So yeah, I'm going to talk a little bit about, I thought I'd start out with kind of a very brief journey of how I got to pulmonary rehab and, CF and everything. And then I'll really tell you the meat and juice about like how I'm doing now. So like Jackie said, I was born with cystic fibrosis. I didn't know until, or I guess I obviously didn't know, but my parents didn't know until they gave me a salt test, a sweat test. My mom always says I taste like a potato chip, which is really funny. It's like a running joke in our family. So sure enough, at 4 weeks old, failure to thrive, and I was diagnosed with CF. I had a pretty mild case growing up. I really wasn't in and out of the hospital a lot until I hit my adolescent years, where, you want to be a teenager, you don't want to do your breathing treatments, and you don't want to do your inhalers. So then my exacerbations really started to get worse, and I was hospitalized for the first time when I was 16. And then after that, it was kind of a small decline, up until college, where my senior year of college, I wasn't like partying and doing all the fun things you do your senior year of college. I was on and off of oxygen. I remember walking down campus with my oxygen and then my IV pole in the other hand. Senior year, I really wanted. And then sure enough, my doctor told me, my CF doctor said, I think we need to start talking about transplant. And I was like, what? am so not ready for that. I'm 22. I want to like live my life and like do other stuff. But I'm really glad that he did, because it took a while to get listed. If any of you have been listed or know about the listing process, it took a while. Also, I have a rare bacteria called Merkel-Cepacia, which everyone on the East Coast, where I am originally from, said, no, we will not touch you. We will not take you. You're a high-risk transplant recipient, and if you don't survive, it's going to make our numbers not look great. And I'm like, oh, okay. So obviously at 22, I wasn't going to take no for an answer. I talked to my uncle who lives here, and he told me that UCLA does hard cases and will take transplant recipients or candidates that are hard cases. So I flew back and forth from Rhode Island to here many times doing my transplant evaluations, had to get some sinus surgeries, tooth things, finally listed after 2 years of trying. So it was a long period of evaluation. So I will give that little tidbit that if you are thinking about transplant or you're trying to get listed, it takes a while. So I would start the process sooner than later. So then I get the call that I'm listed for transplant. I quit my job that day. I was working at the Providence VA doing brain stimulation on patients with PTSD and depression. And interesting, I didn't get to be the patient then. You know, my patients were my patients. So I had to like, you know, kind of hide the fact that I was suffocating in my own body and, you know, it wasn't about me. And so I quit my job that day. I gave my dog to my parents, which was the hardest thing ever. I said, watch her for me. And I broke my lease and I moved here to California, where I had the privilege of meeting Jackie and Joseph and Betsy all in like a span of like a week when I first moved here. I'm not one to sit. And so I studied for my GRE because I knew I wanted to go to grad school. I got a job with Jackie after I was a patient. I was doing EEGs in the ICU for Providence while I was waiting for transplant. I started an art business because I was like, well, there's nothing else to do. I might as well do something. So I had made it my mission to keep doing life while I waited for transplant. And that call came 2 years later. I waited a very long time. I have a rare blood type, AB positive. So I took, So it took a while to find a match. April 14th, I was settling down for a nap. I was like ready to go. I had just had my hair done. Any sort of anything during the day, you guys have probably known is exhausting, right? So I was like, all right, I gotta sit, I'm gonna lay down because I'm exhausted. And I get the call and they're like, hi, this is UCLA. And I'm like, I know I have an appointment on Thursday. You guys always call me, there's nothing different. And they're like, no, we have lungs for you. I jumped out of bed as I'm like suffocating with like my oxygen. I'm like, oh my God. You guys know the feeling. And FaceTime my parents, and it had been established that my mom was going to fly in case it was a dry run, and then my dad would stay back in Cotton when it was a go. OR called me back, so they didn't have space for me then, so I'd have to wait until tomorrow and try to get some sleep. And I was like, there is no way that I am sleeping tonight. My life is about to change tomorrow. And, you know, in that moment, I thought about my donor. I thought, wow, like here I am, the most excited I'll probably be in my whole life for a new beginning, and someone passed away. And so there was really this weird dichotomy between holding the space for both that I still think about her every day. Everything I do is because of her. And so she's definitely in my mind a lot. So next day, get to the hospital. If you have been through a transplant or you know about it, a lot of pre-op, a lot of work. And then, you know, finally get my lungs. Took about a 12-hour surgery. I had a lot of issues afterwards. I will be very transparent about that. Thoracentesis, blood clots, just a lot of issues that came up for me. Finally discharged a month later, and I kind of felt like I got to start my life over again at 26 years old. So now the recovery was rough. You're weak. I was really thin. It's funny. I heard Gretchen say, "You look fat now," because when they saw me, I was really tight. So a lot of recovery in the space of pulmonary rehab again, you know, really being able to walk and how you retrain yourself to breathe, how you take a deep breath, how we use our diaphragm and not our accessory muscles to breathe like this. So once I felt healed and ready to go, I finally went to grad school. So I'm currently in grad school right now. I defend my dissertation next month. I did the dissertation on predictors of health quality of life in transplant recipients, because why not? So I found interesting enough that resiliency, self-esteem, and autonomy are the highest predictors of health quality of life among transplant recipients. So cool study, hope to publish it. I am now also working kind of still the pulmonary rehab if they need me, but mostly sticking with my psychiatric patients. So I work at Harbor UCLA, and I do cognitive behavioral therapy, dialectical behavioral therapy, and acceptance and commitment therapy. So I have about 10 patients on my caseload that I take care of. I also really am a big advocate, like Jackie said, for the CF Foundation and also for One Legacy. If you guys know what One Legacy is, it's one of California's largest organ procurement companies in the country, actually. And they're the ones that coordinate new organs. So I kind of took my experience as a recipient and now share my story with people like this and ICUs and hospitals about the importance of organ donation, and I'm a really big advocate for that. I also, like what else do I do? I also, like I mentioned briefly, I have a small art business. If you have been to the luncheons a couple of years ago, I used to give them away as gifts, making mosaics. So that kind of took off. I kind of had to like have a space for grad school and that, so that was hard. I took a bit of a step back for that. What else am I doing? I do want to be transparent about the upkeep of transplant after you get a transplant. It's not all roses and sunshine like I expected it to be. I still see a variety of providers, endocrinologists, pulmonologists, dermatologists, all sorts of doctors to upkeep, post-transplant. I take about 50 pills a day, and I will for the rest of my life. Immunosuppressants to make sure my body doesn't break down to my organs. It's actually a lot of medications that are to counteract the side effects of the immunosuppressants. So also diagnosed was a fun one when I woke up because of the prednisone. If you guys have taken prednisone, you know what a joy that medication is. I am also really cautious about the sun, which if you guys know me, I love the sun. And it's really hard to stay out of the sun. But I have a very high risk of skin cancer. I did have some gynecological issues post-transplant where I needed also some surgery. So that was a component. It's just not having an immune system that, cancer can spring up really quickly. Other than that, though, I feel like I'm doing well in the health realm. I'm very grateful to be standing here and breathing. You guys know what it's like to be suffocating in your own body, and you know what it's like to be able to talk and like breathe at the same time. It's not always easy. I hear them. So this is just a great feeling to be able to stand here and really like take some deep breaths. I also have to be very cautious about what I'm around. So not only COVID and other infections, but I can no longer eat pomegranates. I can no longer eat grapefruit. These medications or these enzymes in those fruits counteract with my interact with my medication. So there's some fruits I can't eat. I'm not supposed to do anything, like things you don't think about. Like I don't like envelopes anymore, just because it's not that sanitary if you think about everyone touching envelopes in the CVS or something. So small things like that. I have to be careful around certain animals, nothing with scales, they can carry a lot of bacteria. Birds have a lot of bacteria. So I have to be careful about what animals I'm around. I have to be careful what kind of foods that I'm eating, like making sure that I'm at an establishment that has an A on the door and not, eating something off a side street that could potentially be harmful. Really, when you're thinking about post-transplant, it's a lot of like, okay, I'm at high risk for infection. So am I going to put anything in my body that's going to cause an infection? Sushi's a no-go, which is hard for me because I really love sushi. So that's something I had to give up. but I will do it if that means breathing and being healthy. So, and other than that, I'm just trying to live a balanced life, which can be hard in grad school. Kurt just asked me, how's your life outside grad school? And I'm like, I don't even know what that looks like. I don't even know what that is. And I am, like Jackie said, I will be leaving California to go to internship. I do not know where that is yet. Match day is a week from now, next Wednesday. But the places I applied are not in California. It's because I want to specialize in transplant psychology. And so there's only a few places where that is. But I will be back because I belong in California. I feel like it's my vibe, it's warm. So I will do a year of clinical. And then I'll come back in May and graduate and have a PhD, which is very exciting. And then I'll finally live my life, I guess, and feel like I won't be so stuck in graduate school. My ultimate goal is to be a clinical psychologist on a transplant team, really helping patients with their mental health pre-transplant, waiting for an organ that you never know will come. And then post-transplant, how do we deal with all the stuff I just mentioned? And how do you like start over and have a life again post-transplant? And I feel very strongly about that. I don't think I have that mental health support pre and post. No one's fault, just wasn't available. So I'm really making it my mission to kind of give back. Any questions? That's my speech. Thank you. Yeah.
What were this, you mentioned just like in your thesis, there are certain things that are predictors of successful transplants. Will you go through what those were?
Absolutely, yeah. So the question was, what are the predictors that I found in my dissertation? So I was really looking, actually, I thought a lot about what my time in pulmonary rehab and working with different patients. And I remember something that stuck with me that I don't know who it was. Someone said, I don't feel resilient. I don't feel brave. I don't feel strong. This is just something I have to deal with. And I thought, oh, that's interesting because I feel the total opposite. I feel like, hell yeah, like I'm brave, I'm resilient, I'm strong. So I was looking at our self-perception of predictors. So do we think we're brave? Do we think we're strong? Ourselves versus what other people think of us? So does that matter? Does that make a difference? So in thinking about those, when I say self-perception or meta-perception about others, how is it in the space of resiliency? Do we think we're resilient? Do we believe others think we're resilient? Self-esteem, how do we feel about ourselves, in the space of like, high self-esteem versus how do we think others think where self-esteem is? And also autonomy, how do we establish ourselves as human beings again, post-transplant of like our autonomous self in the self, and then what do others think about our autonomy? And so those are the predictors that I found. They were all significant. Interesting enough, though, when I looked at the specific statistics, the highest predictor of health quality of life in lung transplant recipients was self-esteem. I don't know what we think about that. I don't know what I think about that. I haven't wrote my discussion yet. Knowing what I know and personal experience, I thought it would be resiliency. I thought that would be the highest predictor of health quality of life, but no, it actually was self-esteem. So yeah, but I guess it just means we all got to build our self-esteem.
I have a question, comment.
Sorry,
Go ahead, Sandra.
did you say economics as well?
No, autonomy.
Oh, okay.
Autonomy.
I have a question, comment from the Harbor UCLA group. I was also told by a surgeon that they didn't want to operate on me because a bad outcome would affect their numbers, and that felt terrible. While risk versus benefit is certainly important to discuss, is it common for surgeons to say this to potential transplant candidates?
Great question, and it's super common, at least from what I've talked to people about, other transplant recipients, and maybe, I don't know if anyone wants to share here, but yeah, I had that conversation probably like 20 times with different surgeons, and they're kind of straight to the point. There's not a lot of bedside manner with a lot of surgeons that I've dealt with, and so it is unfortunately very common. They have to tell you that risk, and they have to tell you, why you're not being listed or being kind of questioned.
Another question, can you talk about other CF symptoms that are persistent even with the transplant?
Great question. Yeah, I get this because people are like, okay, so you don't have CF anymore, right? It's like, no, I still have CF, just not in my lungs. So I still have funny enough, I just had sinus surgery a couple days ago. I still have really severe sinusitis from the CF. I have a lot of sinus issues, so I probably get a sinus surgery once a year now. It's kind of just like a very routine thing. I still have a lot of GI symptoms. Fortunately, there's no like transplant. I mean, I guess there is, but there's no transplant for me for my GI symptoms. So I still have a hard time gaining weight, like a lot of weight. I still have digestive issues. I can't digest food properly because of the CF. I still have a lot of, I mean, there's still like the CF mucus in my body and other places, like I told you, my sinuses, my throat. So I still have that component. And from when I was told, I don't know this, but I still have infertility from CF. So, and that's still the case. There's still some CF symptoms there. Jackie will tell you when she first met me, my clubbing on my fingers was extreme. And so now it's kind of gone down, but I still kind of have some clubbing. So that's another fun CF symptom that I still kind of stick with. And it's still salty. That's true too.
How do you deal with the dermatology issue? Do you go every 6 months?
I do go every 6 months unless there's some pressing concern. I am very fair, as they like to remind me every time when I'm in there. So I'm very careful about hats, sunscreen in my makeup. And if I see anything on my skin that's a concern, then I make that appointment and they're quick to see me.
Tell them when you book the appointment, you want to take all your clothes off because you want to see them to see what you don't really notice.
Right, exactly.
On your backside.
Exactly.
Bob Marley on the bottom of his foot.
Yeah, exactly. They look between my toes, my ears, even my hairline. I have a mole in my hairline. They're very on top of it.
Sarah, another question. Can you speak about how you deal with so many pills per day? Are there any tips for the rest of us?
Yeah, so it's funny. My mom watches me take them in gulps and she's like, oh my God, please. But you get used to it. I think it's more like I take all the small ones at first. So I kind of just do this quick thing. The bigger ones, some of the ones that aren't coated, those are, you know, sometimes by themselves. But for the most part, it's all about, for me, it's very mental. It's like these little things, these little guys are keeping me alive, you know? So I have to kind of change my mindset of like, yeah, this is super annoying and a pain in the butt, but I know it's keeping me alive. And if that's all I have to do to keep me alive instead of oxygen and breathing treatments and inhalers, like I'll do it. I think also I have found that I cannot not have food before. I really try to take these medications on a full stomach. It just lessens the nausea. I also, the side effects are the side effects, but I have found that, you know, certain medications are better with just water. Like you don't want to take Bactrim with milk or any dairy products, so that can lessen the effects. I have gotten used to a lot of the side effects too. I have a tremor now from the tacrolimus. The diabetes is something very unfortunate, and that's just kind of how it is. But it's definitely a learning curve to be able to say like, okay, like here's what I'm trading off to be able to have lungs. I think also when it comes down to it, I'm thinking about like the adherence of it. I set a phone alarm, so I set two because sometimes I'm like, yeah. And then I have to set another one to remind myself. But at this point, it's such an integral part of my life, almost 5 years now, that if I don't take my meds, I'm like, wait, what? What did I not do today? So it's become such a habit. Yeah.
How did you deal with the anxiety while you were on the list waiting for the call?
This is a great question and one of my favorites because I'm in the mental health field. Interesting enough, I didn't have a lot of anxiety. I blame my parents for this. I think they were great advocates and just great parents of growing up sick and being like, this is something you have, everyone has something and it's just gonna be how it is and you're gonna handle it. And I've never been an anxious person. I don't have that temperament. When I started to think about like, oh my gosh, what if I don't get the call? Like I'm 22, like what if this doesn't happen? What if my life ends, you know, at 22 and writing my advance directive at 22 years old, my friends are partying. And I'm like, what do I want to wear when I'm in the casket? And I want a pink sparkly coffin. And, you know, like, which is very on brand for me. It's still in my advance directive. So like, having a really good sense of humor really helps with the anxiety. My family deals with stuff in a dark humor way as well. So that's always kind of been like a thread. That really helped. I really enjoyed doing stuff I loved while I was waiting, which really eased the anxiety. Like I said, my art business and being around people I love, like Jackie and her squad, and being around my uncle and living here really helped. I think if I had to wait in, like, no offense to Kansas or something, but like if I had to wait in Kansas instead of, a beautiful, warm, sunny place like this, I think it would be harder. So I think there were a lot of factors that just really supported me to ease the anxiety, but I also want to validate how real it is and how real it was. And, I think my thought was like, okay, let's not spiral to the anticipatory anxiety. Let's stick with this and say, okay, right now it's really hard, but, like, what can we do to stay present and not kind of think about the future, which is super hard, but it was something I trained myself to do. And my mom always used to say, don't suffer future pain. And so I take that up with me a lot.
Good one.
Kurt,
Sarah,
yeah.
looking back, any big mistakes that you made?
It's a really good one. I never heard that one. I think it would have been more adherent as a teenager to my CF regimen. I wondered if I would have missed transplant or, maybe like prolonged my original lungs. I was dating a really crappy guy during the transplant process. So I think that made my recovery a lot harder. I wish I had made a better choice there because he really put me through a lot of crap, and my family while they moved here to visit me, and Kurt's laughing because he remembers this story. Other than that, I was really adherent. I was really on top of it. It's hard because you don't have a lot of control about like what happens post-transplant. You only do what you can do. I did have a bout of rejection that was, just happened. But that's a great question. I think that would be only those two things.
I have a couple more, Sarah. Can you speak about how your personal experiences with the healthcare system might help us do a better job, especially with ICU care and during rehabilitation for a large surgery?
That's a good one. I mean, when I was going through my transplant evaluation, you don't get to talk to anyone until you talk to the financial person first, which is the sad reality, but it's true. And if you cannot afford transplant, they will not give you one. And so that is a very real thing that happens in our healthcare system in this country. And it's not fair. And, I watched a lot of people get transplants, then ruined them, post-transplant by smoking or drinking or whatever. And, it's just kind of like how it works, and it's not always fair. So I think the financial part was difficult. I also think standing in front of a committee and saying, this is why I want an organ was hard. That is a very real reality too, that there are not enough organs to go around. And you have to prove your case to this committee that you will be a good transplant recipient. And not everyone gets a transplant, and not everyone is accepted. And so that's hard. I wish we had a different system in, like France, where everyone's a transplant or everyone's a donor unless you opt out. But that is the real reality. I can honestly say my care in the healthcare system in regards to like the ICU or the nurses was just incredible. I just had a great experience at UCLA. Everyone was very on top of it. Everyone was very caring. The nurses were like also mental health support afterwards, where you're dealing with everything. And I felt very, very held by them. I had one nurse, we joked and called her Nurse Ratchet. When I woke up from surgery, she was like, what does this medication do? And I'm like, I don't know. I just woke up from surgery. I have no idea. Like, give me a minute. But in the end, it did help me to know what I'm taking, what do these meds do, and you're going to take them for the rest of your life. So you better figure it out.
Also, has your clinical psychology training and personal experiences helped with counseling both younger and older potential and post-transplant patients?
Absolutely. That's why I'm doing it. I think having personal experience, and not that you need to, but it definitely helps with a layer of empathy that I think maybe not all patients or not all providers have. I have worked with patients all lifespans, but majority of older patients that I love that population. I want to go into geriatric psychology as well as transplant. So that end of the spectrum, you're dealing also with existentialism. Did you live your life well? What does it mean to have a full and meaningful life? So there's that end. And then I don't work with a lot of kids with transplant, but a lot of kids with chronic health conditions like diabetes and autoimmune stuff. And it's like, okay, yes, you're young. How does it feel to be young in a healthcare system that feels very old? And how does it feel to, be not like your friends? And so I think a lot of my personal experiences have really collided with my clinical work.
Have others in your family been affected by the CF gene or your illness?
No. No one in my family has CF. No one in my extended family has CF. My mom told me a story once from like, I don't know, like 19, I want to say 30 or something, about some kid tasted salty somewhere down the line, but that's about all. And they didn't know what CF was then. But my brothers don't have it. They're not even carriers. So it's just kind of a fun gamble of 1 in 4 chance that I would have CF. And my parents didn't know they were carriers of the gene. So, I came out and they didn't even know. So. Yes.
Do you remember, or do you still keep in contact with your surgeon?
Oh yeah, Dr. Hunter, he was amazing. He moved to Utah, but he was one of those surgeons that was just very personable, and it was a great experience. He was wonderful.
Sarah, I have 2 questions.
Yeah.
I have no idea what it means to taste salty.
Yeah. I'm gonna go over there.
My other question, and why is that?
Yeah.
And then you mentioned the economic, the financial part of it.
Yeah.
Does insurance cover this? Or, where do funds come from?
Absolutely valid. Yeah. So first of all, with CF, we have a problem with our chloride channels. So we cannot release salt and process salt the same way. And that's the main component of CF. So our skin is very salty. That's why. And so if you guys are, you're sitting on a hot day and you feel your skin and it feels salty, you're at the gym and you're sweating. That's what my skin feels like constantly. So like, if you guys ever see me do this, because I have salty eyebrows. So that's what it is. My mom just says it tastes like potato chip without the potato part. So it's just basically like a salt lick, which is why dogs love me. And it's not
We're all gonna have a chance to get a lick before you leave, right?
Oh yeah, and then Jackie knows I'm terrified of butterflies because my parents thought it was a great idea to send me to a butterfly farm as a kid, and they love salt, and I was attacked, and I'm terrified. So that whole thing about people love butterflies and it reminds them of someone passed. I'm like, oh hell no, I'm not coming back as a butterfly. I'll come back as like a bug. I'm not coming back as a butterfly. And also the financial piece. Yeah, it's insurance covers most of it. You have to make sure you're on really, really good insurance to be able to pay for your medication post-transplant, because that is in itself is extremely expensive. From what UCLA told me, it was about $300,000 for just the transplant itself. 300,000. So insurance.
Above insurance,
No, that's like just total. And then I was spent a month in the hospital post-transplant with all these problems. So it was a hefty bill when I came out. But yeah, there's payment plans, there's insurance, there's certain like discounted things that you can get. I'm sure you've seen like GoodRx or something like that for your medications. It's possible, but they are very real with you about like, this is a lifelong thing. It's not like you get a transplant and it's over. You'll be spending thousands of dollars for the rest of your life on your healthcare.
Sarah, can you talk about the psychological dilemmas associated with living related, like your parents or siblings versus non-related organ donors? Is there guilt or other emotions to deal with?
Sorry, in me or in your people?
Can you talk about the psychological dilemmas associated with living relatives versus non-related organ donors? Is there guilt or emotion to deal with?
Yeah, there was some guilt growing up that I was like the favorite child, because not really, but I was just a sick kid. So my brothers didn't get as much attention as I did. They like to remind me that I got all this stuff as a kid, sibling stuff. I think I felt a little bad about that. Not that I wanted that experience for them. They also joke that good thing you have CF because we could never handle it. So there is that like reality there. I think I felt a little bit guilty that not that someone had to die for me, but that it is kind of what it felt like. Someone had to die to save me, and she passed away anyway, but there still was that kind of sense of like, wow, like, you know, like I'm getting someone's organs and they can no longer live. And so there was a little interesting feeling about that. I also felt angry when people that had, you know, smoked for 75 years were getting transplanted before me. Transparently, that felt unfair. It felt unfair. So there were some psychological aspects to being human and going through this process. I think I feel bad for my parents still. Thank you. I'm like,
I know, I hear you.
thank you. Feel bad for my parents still that, I mean, they love me, they're my parents, but you know, that they had to take all this time and energy working on a sick kid, you know, maybe not having the experience that they quote unquote wanted. They remind me that, no, you're a gift and blah, 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 like parents do. But, you know, they took a lot of time and energy to take care of me post-transplant, and just my childhood was not their first kid, you know, not what they had planned. And so I'm very grateful for them. And I also sometimes feel like, oh my gosh, I'm sorry. I'm sorry, it's so much work. $1 million baby? I just keep giving them everything. I just keep spending.
Sarah, today you're doing clinical work
Yeah.
and you're working with people who are just stepping into what you've experienced. How do you keep from going down into the pit with them?
Yeah, that's a challenge in any clinical space, because you want to empathize with your clients and you want to be able to say, I get it. And like, there's a space in clinical psychology where you're not disclosing your own personal stuff, right? And it's not about you. And so I do a fine balance of disclosing what I need to disclose to build empathy, but also not going there with them, because they don't need another person down in the pit with them. They need a cheerleader. They need someone who's going to bring them up. And I have to remember that role. But there's definitely times where I'm like, I know, it freaking sucks. I know, you know? And so I think also being able to validate that. And it's a fine balance. It is. And there's some days where I get out of session and I'm like, oh, you know? So, yeah.
Yeah, so what are your strategies for keeping yourself healthy while you're coaching someone in a positive way?
It's a lot of self-care. A lot of like doing what I love to do. It's a lot of supervision, which is why we do supervision. It's a lot of support from my family and friends. Helpful enough. Most of my friends are psychologists, so we are really our own community with each other. And sometimes I'm just very radically genuine about like, yeah, I don't really know what to do for you, and we're just gonna sit in it, and we're gonna sit in it together. And sometimes most of my sessions are patients just crying, and you know, you hold that space for them, and that's really therapeutic.
Yeah. And you've gotten rid of the rotten boyfriend.
Oh yeah, he's gone. He was gone after transplant.
His loss.
Yeah, thank you.
Still got your cute car?
I still have my cute car. It's outside. It's lime green. You guys ever see me driving a Jeep, lime green Jeep? It's me. Wave, beep. Yeah.
What is probably the most difficult or most tiring question you have from others, once they find out you had a transplant?
It's funny because I've gotten so many different questions and it's never really the same. I think the one I hear the most is like, oh my God, you look so good. Who would have thought, you know, not even just a comment of like, well, you don't look sick. Or I even got that or pre-transplant, which I think is like, well, what does that mean? And you know, it's like, am I supposed to look at like, I think what has been the hardest personally is the body changes. Like Jackie knows I used to be like 80 pounds and then I'm not, and it feels weird. It looks weird. I have some moon face from my prednisone that only I really notice, but it's challenging when people are like, oh my God, like, you know, you look different. And like, what does it mean? And, you know, all my hair fell out post-transplant. So that was a change that Jackie had to hear about too. And so, that's the hardest to hear, like when I keep hearing like, oh, you don't look like yourself, or you don't look the same. It's like, oh, I hope I look healthier, you know? And I think also, the expectation of like, well, you had all these things done, so you should just be like relaxing now, chilling. And I'm like, wait, no, like, I got a second chance to live it. And so I have to kind of show people like, okay, you get the second chance. Now what are you gonna do with it? I also get some interesting questions about like fertility. Are you gonna have kids? Can you have kids? I can't have kids. So in case anyone is wondering, I'd have to stop taking my transplant medication. So it's me or the child. So they are very real with you about that in your evaluation.
Is that true for most transplants because of the medication?
From what I know, lung, it's very discouraged. I couldn't speak to like kidney or anything else.
Why are you careful of
Apparently, well, I didn't know that was a thing, but they told me with all the trauma, all the bodily trauma, the body just decided like, okay, hair is like the least important thing that we need to be worried about right now. And it just all fell out. And that in itself was a mental health crisis. Yeah.
It's beautiful.
Oh, thank you. Yeah, now it's kind of getting back to normal.
Any dental problems or issues that come up with transplant?
They definitely are really big about your teeth, and they're making sure that you're really taking care of them. I have to take antibiotics before I see the dentist because, you know, they're scraping everything, and if you're eating it, like, you know, infection. Other than that, I'm pretty anal about my teeth, so I'm like constantly flossing and things like that, so I haven't had really any issues.
How often do you get teeth cleaned?
6 months, every 6 months, teeth cleaning. Mhm.
Many of the transplants that are here are going to have transplants.
Yeah, I can tell you firsthand. Not everyone's experience is the same, but
I know.
Yeah, I was just gonna say, when I asked that question about what consultation I get, you know, your donor was?
oh yeah, I get that
Yeah.
too. Mhm.
And it's like, no,
No.
and we won't know unless they decide to come forward and find out, you know, my loved ones.
Yeah.
You know, organs were given away, and can I find out who got them, pretty much.
Yeah.
Because I know a lot of people who have sent their letters, never get a response back.
That was me.
Yeah, and other ones that, you know, they got response back first or second letter that they sent. And, you know, you gotta look at it from their standpoint. They have a loved one that perished, and so someone had died, if I do those particular organs. And, it's tough for a lot of people.
Exactly. I used to say it's the best day of my life and probably the worst day of their life. And I have to remember that because I wrote a letter and I never got a response. And I have to remember that, yeah, like it's not the same experience as you. So.
Because 4 years for you is like yesterday.
Yeah. Yeah.
Yeah, it's the double-edged sword. It's like funny because when Jesse and I would see somebody go off for a transplant. We were so happy for you,
Yeah.
but we had to stop and say a prayer for those who were donating. And somebody had to die to give you the life.
Yeah.
They did a good job.
Wow. I hope she's proud. Yeah.
When they do a transplant, do they go through your back?
No, they actually, at UCLA, I heard different things. They cut you this way. It's called a clamshell incision. So I have a huge scar that goes across here, and then two, I call them bullet wounds, two big scars in here and here from the chest tubes that were in post-transplant. And they crack your sternum open, so then they gotta like wire that shut. Bunch of like wire in here.
Yeah.
Bras suck after transplant.
No underwear.
Yeah, no underwear. Oh, my mother's wonderful. She is. She just left Edna. We should talk. She was here.
Sarah, I just need to say, you all just amazing.
Thanks for absolutely
course.
a magnificent share. I think everyone here just thoroughly enjoyed your speech, so.
So glad to be able to talk to you guys. And if you have any more questions, you can send them to Jackie and I will definitely answer them.
Thank you, Sarah.
Thank you. That's cute, right? It's snowing, we're so happy.